So the topics of discussion for today, we'll discuss a little bit about the history of the physician assistant profession, the physician assistant profession today, a growing profession. So let's talk about a short history of the physician assistant profession. In the 1960s, Dr. Eugene Stead, who's regarded as the father of the PA profession, created the first physician assistant program at Duke University. The first class members were military personnel, mainly U.S. Navy corpsmen and U.S. Army combat medics. They graduated from Duke on October 6, 1966, which is considered the date on which the profession began. Today, the week of October 6th through the 11th is recognized as National Physician Assistant Week, commemorating the graduation of that first class. The physician assistant profession today, there were approximately 108,000 plus physician assistants eligible to practice in the U.S. and its territories at the end of 2015. According to the Applicant's Manual of Physician Assistant Programs 2016, 70.3% of physician assistants are female, and the median age of PAs is 26 years old. Surgical specialties top the list of specialties at 26.3%, followed by primary care at 24.4%. In 2016, physician assistants enjoyed a median salary of $97,000. That's the median salary. The demand for PAs has consistently increased, and the number is expected to reach 150,000 by the year 2020, and will continue to grow after that. The PA profession, a growing profession. The PA profession is growing in leaps and bounds. As fast as the profession is growing, the applicant pool is growing even faster. In 1980, according to the American Academy of Physician Assistants, its membership was 6,975. In 2000, the number of practicing PAs was 40,469, and in 2010, it more than doubled to 83,466. Now, there's three major reasons for the boom in the PA profession, and they are as follows. First, there is a shortage of physicians. Due in great part to the Affordable Care Act, many physicians have opted for early retirement rather than alter the way they've practiced medicine for years. Second, members of the baby boomer generation have come of age and have started to take their place on the Medicare rolls. And third, there has been a general expansion of the healthcare needs of the public over the past few years. There are about 40 million more people now enrolled in the healthcare system, and the medical profession is hard-pressed to supply enough healthcare providers to keep up with the demand for quality healthcare. Now, the applicant pool for the physician assistant programs is growing at an even faster rate. There's no surprise when one considers the potential the physician assistant profession holds for the future. The PA profession ranks number 4 in best healthcare jobs in salary, employment rate, tenure growth, job prospects, stress levels, work-life balance, according to the U.S. News & World Report. It is also the third fastest growing profession in the country, as reported by the U.S. Labor Bureau. Now, Forbes ranked the PA profession as number 1 of the 10 most promising jobs of 2015, and the Bureau of Labor Statistics estimates it will grow 30.4% between 2014 and 2024. With 94,400 job openings, according to the Bureau of Labor Statistics in 2014, and an average salary of $111,000, it's no wonder. It is also no wonder that entering the field is fiercely competitive. A 2015 AAPA study found that more than 96% of PAs would recommend their PA career to others. In 2015, there were 190,721 overall applications to PA schools, with 8,603 students enrolled ultimately. That is a shocking 4.5% acceptance rate. Indeed, the average national acceptance rate has been between 5 and 9% for the last 5 years or so. Now, physician assistant training. PA training is shorter compared to that of physicians. Now, although physician assistants are trained in much the same way as physicians, there is no residency at the end of PA school. Residency adds at least 3 years to physician training before they can practice medicine. PA's training, however, is roughly 27 months, and graduates typically earn a master's degree. This includes the latter portion of the training, which takes place in the form of clinical rotations rather than a residency. Now, the profession is moving toward an all-master's degree education by the year 2020. Although physician assistants are dependent practitioners, one physician can supervise many PAs, and the exact number depends on the practice statutes of the respective states. Now, according to the Accreditation Review Commission on Education for Physician Assistants website, there are 225 accredited PA schools in the United States. The average number of programs applied to per student is 8.3. Physician assistant admissions committees will not be impressed by grades alone, and good grades will not get you an interview necessarily. Applicants have been invited for an interview because of their personal narratives, which ignited a spark of interest in the admissions committee. This has been proven to be true in spite of perhaps a lackluster academic record or inadequate medical experience. I mean, this is your first opportunity to really connect with a member or members of the admissions committee who are reading your personal narrative. Now, EXCELL employs a concept called ultimate strategic planning. And this concept utilizes the approach of stacking all your experiences in such a way that you may represent yourself in the most effective way. Combining your experiences and the skills taught in this program is a winning combination. Ultimate Strategic Planning, USP, is a concept developed by Chet Holmes, a master marketing and business strategist. Broadly described, his strategies involve taking all of your marketing tactics and stacking them. In other words, each element of presenting yourself should not be viewed as a separate entity, but rather each should maintain focus on the message trying to convey. This reinforces the portrayal of yourself as the ideal candidate for PA school. So, what does a marketing technique have to do with applying to PA school? Look, you have to understand one important fact. You are selling your ability and competency to be accepted to the physician assistant school to which you're applying. The candidates that present or sells themselves most effectively gets accepted. Now, as it relates to PA school, the application process, USP means that you take all your experiences and make them patient-centered. Every piece of material you use on your application should be patient-centered. This includes your volunteer experience, shadow experience, and healthcare experience. The patient should be the focus of your personal essay and your interview. Now, as often as is practical, it is imperative to utilize these patient experiences when answering your interview questions as well. These are skills that have been proven effective in the real-life laboratory of the EXCELL Pre PA Clerkship program. This is a driving concept used by our students, resulting in EXCELL's 97 to 98% success rate. EXCELL graduates have met program prerequisites, have secured admission to at least one of the schools to which they've applied. Now, many EXCELL graduates have been accepted to more than one PA program, in fact. So now I'd like to take this opportunity to talk about EXCELL. Why does the EXCELL Pre-Physician Assistant Clerkship have a 97% success rate in a market that's 4.5% nationally? You know, I've made a study of this for the last 5 years, and I've got out of a lot of the forensic sort of, what's a situational question, what's an ethical question, what's a behavioral question, because the reality is you're not going to sit there and ask yourself, gee, is this an ethical question or is it a behavioral question? It's not going to happen. You're in the moment, and what we try to do is try to work with human nature and human needs. What we at EXCELL have determined over the last 5 years is that by focusing our training on human nature and human needs, we've been able to help students more naturally and thereby effectively and confidently write their personal narrative and present themselves at the PA school interview. We do this by focusing on the 6 basic human needs. Now, every human being has these 6 basic human needs, but each of us regards them at different levels, and there are 2 that are usually primary. By determining the 2 primary human needs, we're able to help the student focus through training that's specifically geared to their particular 2 most influential human needs. The result is that they become much more confident, much more comfortable when discussing their desire to become a physician assistant because it comes truly from where it means the most to them. They become basically an expert on themselves in the context of the physician assistant profession. This has been the reason why we have had such a great success rate, 97% for our EXCELL graduates. At EXCELL, the program structure is 2 days a week, 12 hours a week, so 6 hours a day for 2 days for 4 months. Or you could do 3 4-hour days if you wanted to for 4 months. It's a triphasic program. So that means that we have PA mentoring and not just shadowing. I mean, shadowing is part of mentoring, but mentoring is a much deeper relationship. Your mentor's available to you throughout your process and beyond. I mean, many of our students that we've mentored are now PAs, and we've actually helped them in their job search and just coping with their first job as well. There's a didactic portion, which is the online portion. There are 34 modules online that discuss everything about interviewing, essay writing, advanced interviewing techniques. There's tests and quizzes. Also, there's the practical or patient contact portion, which is the quality of life survey, where our students perform a quality of life survey for all different quality of life issues that patients deal with in the centers that we are partnered with. As I mentioned earlier, our students take the results of this survey and they make their reports to the administrative staff of the facilities weekly. At the end, they do one major report to show the trends of improvement or decline in the different areas that are covered on the survey. So they're part of the healthcare team. They have the one-on-one rapport with the patients, and they develop their rapport building skills. Additionally, we provide a personal essay review. The personal essay review is done by me personally. What I do is we do the review, and then I will then do an edit, and the edit is done in such a way that I show you what I changed, why I changed it. It's all written on there. I use different color fonts and highlights to explain that for you and map that out. There are also 2 mock interviews, one in the 2nd month and one in the 4th month. We video record those interviews and the critiques at the end. So you'll be able to review that in a private Vimeo channel. Only you have the password and myself. Improve on your performance, and you can use them even before you actually go and interview. If you require a 3rd mock interview, we provide that for you just before your actual first PA school interview. I hope you've enjoyed watching this video as much as I've enjoyed making it for you. And please send us your feedback. You can email us your feedback at letusknow@excelleducation.com. And remember, don't just chase the dream, capture it. Thanks very much. This has been Phil Festa from EXCELL Education.